Good day, everyone. Good morning, good afternoon, good evening, from wherever you're watching or whatever time you're watching. Welcome back to my channel, Thrive with Her. So in today's video, we'll be talking about what your full blood count result really means. Most times you go to see a doctor, you visit a clinic, and on your test report, you see FBC. That's meaning full blood count. So, and you're wondering, have you ever felt confused or unsure of what it really means? And at the end of the day, when your sample is collected, result comes out and you find it difficult to interpret the result. Have you ever asked yourself what it really means, or are you really confused or unsure? In this video, I'll break it down step by step, what each values means and what it signifies, and the importance of full blood count. So using simplified languages. The importance of full blood count cannot be over or underemphasized because full blood count is very vital for testing procedures. It helps to guide clinicians and we scientists on areas to focus on. The red cells, once there's a decrease in your red blood cells, begin to question what could have decreased the red cells, what could have brought about decrease in the red blood cells. If the WBC is either increased or high, same thing with the red blood cell. If it's either low or high, begin to ask questions. What could be wrong? Are we having dieting problem? Is the person a sickle cell? Is there any injury anywhere? Is there an internal injury? Is there a parasitic infection? The various questions will begin to come up. Is he a child? Is he an elderly person? All these things are various questions that will arise when the red blood cells are either low or high. Then when your WBC is low or high, we begin to look for bacterial infection, sometimes viral infection too, especially in children. Most times when they are infected with viral infection, their white blood cells, the components of the white blood cells, are usually either high or low. It could also affect adults, so it's a two-way thing. So begin to check, okay, what's going on. Then if your platelets are either high or low, begin to look at clotting factors. Begin to ask, do you have any clotting problem? Do we still go ahead with this? Do doctors still go ahead with this surgery? Is there any clotting issue? What time did the sample clot? So these are questions that could arise from your full blood count results. So that's why it's paramount. When a doctor requests, when you're sick, you're very down, you say, I have malaria. I know it's malaria. Why is the doctor requesting for full blood count? It will help guide the doctor. If it's actually malaria, or it could also be other things he could be looking at. From a full blood count result, he could know whether your red cells are low. If we should, maybe after treating malaria, you should also add blood. From your full blood count, you know whether you should proceed with that surgery. From your full blood count, you could know if they will treat bacterial infection or any other systemic infection that could be caused by viral or bacteria. So most times when full blood count is requested, it's not because we want you to spend money, but it's because we are also looking out for other things to help you. It's a best standard practice. Full blood count is a simplified test that aids and guides clinicians and scientists in making diagnosis and in treatment. I hope you found this video very helpful. If you have questions regarding results interpretation, your full blood count results, if you have issues understanding it, if you require consultation services regarding results interpretation and other lab services, and you're unsure, please feel free to reach out to me in the comments. I'll be replying your messages in the comments. Thank you all for engaging in this video. Please like, subscribe, share to your friends and family. I'll see you all in my next video. Thank you. Bye.